this morning. And this panel discussion is on memory care placement. And so we have Jack Poifer, who's the executive director of Vista Cove Rancho Mirage, which is a dedicated memory care community. We have Jennifer Morton, who is the director of sales at Brookdale Rancho Mirage. And Jennifer works in a community that has varied levels of care, which include the memory unit. Heather Scott is from Desert Cove in Desert Hot Springs, and they do assisted living and memory care, but also Heather has some really interesting news to share with all of you about the Medi-Cal waiver for assisted living. And I believe Heather or Floyd can correct me. I think they're one of the only communities in Coachella Valley that has that particular waiver. And then Matt Siegel. Matt is the owner and operator of Attentive Manor. He has two small 6-bed homes, one in Desert Hot Springs and one in Cathedral City. So I'll start off with Jack, and each of the presenters are going to address what their COVID protocols are for placement, as well as family visits and things like that. So Jack, I'll go ahead and turn it over to you.
Thanks, Pat. I'm Jack Poifer. I'm the director of Vista Cove at Rancho Mirage. We're the Valley's only exclusively memory care community. And we're also the only community that has a locked perimeter. Everybody else has delayed egress of some point. We have about 2.5 acres, so we have a lot of room outside. We have 2 buildings inside the perimeter. People are able to go back and forth. So there's a large sense of freedom and not being confined here. We went in lockdown on March 5th and only allowed essential medical visits, and inside visits, we're still doing that. We are allowing outside visits, socially distanced, wearing masks. That seems to be going pretty well. With memory care, there are some residents that aren't able to comply with that. So we do through the window or across the fence visit if they are not able to maintain social distance. We are admitting again, we're not running the day program. Do ask that people have a negative COVID test, and licensing has just mandated a bit ago that 10% of the staff be tested monthly for COVID. So we're doing that as well, in addition to the extra cleaning and sanitizing and hand washing and all the things that go along with that.
Is that it, Jack?
Yes.
Why don't you, I think it would be helpful for the families to kind of know what kinds of programs you offer there for those, and how the buildings, the A building and the B building might be a little bit different based on the progression of the disease, and about your hospice waiver.
We do have a hospice waiver. We take care of people all the way through. We have, as you mentioned, we have 2 buildings. One building is people that are further along and usually need a little more help. So we're able to make the activities more specific and geared towards where people are at in the process. COVID certainly has been a challenge. We used to do large group activities with both buildings. Right now we're keeping the buildings separated, and people that live in a neighborhood, trying to keep them as separated to some extent from people in other neighborhoods. So we're doing more activities on the neighborhood level, smaller group activities, and fewer people in the large group activities. Fortunately, the weather's nice and we'll be able to go outside, and we have the space to socially distance outside.
All right, Jennifer.
Sorry, I have a quick question. You mentioned hospice waiver. What exactly is that?
Licensing requires that a community have a hospice waiver, in order to have their residents receive hospice services in their communities. I think most of the larger places, I think probably the majority of assisted livings have a hospice waiver. So we have 56 beds. We're allowed to have 12 residents at a time on hospice.
Okay, thanks.
Ready?
Ready, Jennifer.
Okay. Hi, everyone. Happy almost Halloween. My name is Jennifer Morton. I am the sales director here at Brookdale Rancho Mirage. And we are the Brookdale that is on Country Club across the street from Eisenhower Hospital. And we're closest to Bob Hope. So that's us, Brookdale Rancho Mirage. I've been in the senior living industry for 9 years. And one of those years I was actually an activity director for memory care. So definitely very, very passionate about that community. I also was raised by my grandmother who ended up having Alzheimer's. And at that time, there was only a skilled nursing close to where we lived. So she was not able to benefit from all the things that everybody on this call today can offer folks. So definitely have a passion and a love for this segment of our population. I represent a CCRC. It's a continuing care retirement community. That's what CCRC means. And it's a place where we have multiple levels of care on one campus. So to be a CCRC, you need to have 3 levels of care. Here at Brookdale Rancho Mirage, we have assisted living, we have memory care, and then we have our skilled nursing and rehab. So this allows people to move in and age in place. So once somebody moves in, they don't have to move somewhere else. Just like Jack was mentioning, we also have a hospice waiver for 20. So when people do go on hospice, they don't have to move out of our community either. The other benefit, I would say some of the benefits of a CCRC, maybe it's a couple and one of the spouses needs to be in our memory care, but the other spouse would be just fine living independently in our assisted living. We can accommodate that. So we can have a couple move in, live in their 2 different areas, but be able to interact and see each other every day. And that takes a lot of pressure off the other spouse when they know that they're here in the same building, and then they can interact and be a part of the care program for their spouse. Another benefit is if a resident would ever need to be in our skilled nursing or rehab for a short period of time or a long period of time, the people living in our community have the first priority. So there are several skilled nursings in the community, but it's nice for a resident not to have to go to another building to be taken care of with their skilled and rehab needs. They have the priority to go into our skilled and rehab before people coming in from the outside. So those are some of the benefits of being in the CCRC. Another part that's nice is that if somebody has mild cognitive impairment, if they're not quite to that dementia level, it's on its way probably, they can start out in our assisted living and receive all the benefits and care that they need. And then if they then do need dementia care or Alzheimer's care, they can just move into our memory care community. So lots of benefits of having several levels of care under one roof. Let's talk about COVID. So since mid-March, we have been implementing the Johns Hopkins hygiene and safety protocols. So we started taking temperatures twice a day of our residents and our associates starting about mid-March, and we continue to do that through today. We have not had any residents or any patients have COVID during this entire pandemic. I know that could change at any time. We knock on wood and feel very blessed every day. We have had a few associates test positive, but no residents, no patients. So we feel very fortunate about that. We are allowing outdoor visits. Those are by appointment, and they're 20-minute visits. And then we take 10 minutes to sanitize and do all the cleaning in between for the next visit. And so now that it's getting to be a little nicer weather, we'll probably be able to have more appointments since it's not, 120 degrees outside. More people will want to come see their loved ones, and we'll be able to accommodate that. Also for the eating, the meals in our memory care, we do have 3 really nice sized rooms. One's the dining room, one is an activity room, and one is an additional activity room, basically. So we have not had to take the meals to our residents in their apartments. They've been able to come out and have their meals because we're able to divide them up and socially distance them in small enough groups that they can come out and interact with each other, but still be safe. So that's been a really nice thing that we've been able to do. Everyone is wearing masks. As you can see, I'm sitting in my office and we wear a mask. That's the protocol here at our building. We all have masks on all the time. And our residents, they have masks on. In memory care, that's a little bit more difficult. So we have instituted the TheraWorks program. And basically what that is, the TheraWorks is, it's a foamy substance that we are putting on underneath their nose and on their forehead and on their hands. And we're doing that several times a day. That as an additional barrier against anything that would be infectious or with germs. So again, it's called TheraWorks, and we're doing that several times a day. We're just doing it in between activities, before meals, after meals, when they get up in the morning, before they go to bed. Again, just right under their nose, their forehead, and their hands, because we cannot enforce them wearing masks, and they have a hard time social distancing. So we want to make sure we're giving them additional protection. So that's something that we're doing here at Brookdale. I mentioned the outdoor visits. Of course, we can still do window visits. Because we don't have a big gate around our community, we can schedule for family members to come to their windows, our residents' windows, and they're able to do window visits. We can schedule those. And also, of course, we're doing everything we can with Zoom and FaceTime for family members that live out of the area so that they can stay in touch with the residents. We just use our own phones, the caregivers, the med techs, the activity directors. We all just jump in there and make sure that they're getting the FaceTime and Zoom visits also. I know that you wanted us to give a little indication of pricing. For our community particular, we have 24 rooms in our memory care. 22 of those are private, 2 are shared. A private studio begins at $43.50. And the shared studio is $31.50. And for a shared studio, they're just sharing a bathroom, and they have the same amount of space that they would have in a private studio. They just have 2 people in a larger room. The care is a la carte here at our community, so residents are only paying for what they need help with. And we do have a $2,800 care cap. So that's nice for people to know that it's never going to go over a certain amount of money. The staffing in our community, we have a nurse that's dedicated to the memory care community. We have 2 nurses in the building. One's dedicated to memory care. She offices there. Of course, we also have a full-time resident programming director, medication technicians, resident assistants. So we have a lot of eyes on the prize, if you will. In addition, we have a beautiful outdoor area that's all gated, has a mountain view. It's just beautiful, and it's really nice this time of year. We've got a nice gazebo out there that people are able to go out and relax in, and we're also starting our outdoor gardening and planting program, so they're getting involved in that. And then, of course, I know everyone does training for their resident assistants, their whole staff. We do online training with dementia specific, and then, of course, we do hands-on in-services. So we're just kind of keeping everybody above or ahead of the curve, if you will, on whatever is latest and greatest in helping really serve this population and do the best that we can with that.
Thank you, Jennifer. So Heather Scott from Desert Cove.
Hi, good morning. Desert Cove is a 28 bed facility in Desert Hot Springs. We are an assisted living waiver approved facility. Each unit features private bathrooms. They can be shared or private, spacious kitchenettes, and the rooms are rather large. Each one has a patio as well, so it makes it more like a studio apartment for the clients, which they enjoy. The setup is rather unique, so we have a lot of outdoor space, and then we do have a central dining room and activity room. The outdoor areas we're doing our activities in, as well as some small group activities in our activity room, but we're trying to social distance outside as much as possible when the weather permits. Our community also features a beauty salon on site, as well as a Namaste program. Our Namaste program is caters towards dementia residents, where we take 3 to 4 at a time and provide them with a lot of one-on-one care and do massage, aromatherapy, sound therapy, to try and get them through sundowning or agitation, aggression, those type of things, so that they are kind of catered to for an hour or so by one caregiver, and she just concentrates all her time on those certain residents that she has brought into the room. As Pat has said, we do accept the assisted living waiver program, as well as work with other community organizations to help bring down the cost of assisted living. We do have private pay clients as well, but we do have a number of government organizations that can help pay for the cost. So the assisted living waiver program that we accept here, they will help pay for a large portion of the care cost. The clients are responsible for a small room and board rate of $1,069, and then Medi-Cal pays for the remainder of the care cost, according to what a care coordinator agency states as their assessment. There is only 15 counties in California right now that have the assisted living waiver program, and Riverside County is one of those. They must have a full scope Medi-Cal to be eligible for the program. And if they have a share of cost, they have to have the ability to spend the share of cost down prior to being accepted for the assisted living waiver program. To spend the cost down, it's not as hard as it sounds. It's like you have to purchase, say, vision policies or burial policies, or a monthly cost, so that you bring your income down so that you're eligible. To be also approved, you have to have care needs equal to those received in skilled nursing, but are able to reside safely in assisted living. So a lot of residents that are in skilled nursing now are in there due to cost at most of the time. Those that are living there long-term are due to not having any other place to go that they can afford. So Medi-Cal is trying to wean them out of skilled nursing and into assisted livings by helping with this program. If they do not need a full-time nurse or physical therapy every day or occupational therapy every day, they can transition into assisted living under this program, because we can bring in outside sources to provide those benefits to them on site. New applicants for the assisted living waiver program should be aware there is only a number of slots available, and there is a wait list. But if your loved one is in skilled nursing, the wait list can come down from 2 years to 2 months in certain circumstances. So if a loved one has to go into skilled nursing for any reason, it's best to talk to the case manager about the assisted living waiver program at that time so that you can minimize the time you are on the waiting list. That's pretty much it on the assisted living waiver program. If you have any questions, you can definitely contact us and we can help you further on that program. There's also other programs such as Inland Regional Program and the San Gabriel Pomona Regional Program that will assist in cost as well. So if you'd like information on those programs, you're welcome to contact us.
I think what we'd like to do now, Priscilla, has Matt joined yet?
No, he has not.
Okay. If any of you do have questions for any of the panel, if you want to unmute yourself or raise your hand or put something up in the chat box, then you can direct that question to whomever, or maybe you want all of them to respond.
Can I ask a question with Heather? With the assisted living waiver, so there's a 2-year wait list if somebody is coming, say, from their home and moving into moving in there. Would that?
There is, yes. It is updated rather frequently, but majority of the time when you contact a care coordinator agency and you submit your application, the waiting list, if you're in assisted living or at home, is typically at least 2 years. Yes.
And then, so with the Medi-Cal, the thing is with Medi-Cal, you have your community-based Medi-Cal, and that those criteria are different from the long-term care Medi-Cal, which is skilled nursing facility. So does that, this is where I have some confusion. So if with the Medi-Cal waiver, that's based on the long-term care Medi-Cal criteria?
As long as they have full scope Medi-Cal, they're eligible for assisted living waiver program. The only thing that makes a difference with the skilled nursing is the time frame it takes for them to get into an assisted living under that program.
Okay. Okay. So, all right. So again, I'm assuming it's a long-term care Medi-Cal that we're talking about, because generally your share of cost, you don't have that share of cost like you do with a community-based Medi-Cal.
We've found some participants do have share of cost, even if they're not in long-term care. So I guess it just depends on the person.
Okay, because it's like $600 for community-based Medi-Cal, the share of cost, you have to spend down $600 a month. You know, so say you're getting, yeah, so, okay. All right, and then, but transferring from a skilled nursing facility in, it may be only 2 months to be able to get into a bed there.
Yeah, you can get in rather quickly if they're in skilled nursing already.
Okay, okay, that's good to know. All right, thank you.
Anyone else with a question?
Yeah, Helen, go ahead and unmute yourself.
Yes, I had a couple of questions for Jennifer about Brookdale. And the first one was, in the assisted living, are those accommodations like little studios, or are they apartments, or what do you have in assisted living?
So in assisted living, we have studios, we have 1 bedrooms, and we have 2 bedrooms. And the prices range from $28.95 to $47.95. So studio, 1 bedroom, and then 2 bedrooms.
Okay, and then my other question was, you mentioned that somebody might be able to start out in assisted living, and then if they later needed memory care. Would that be true if the person has a diagnosis of Alzheimer's? You would still accept in assisted living as long as their functioning seemed to be appropriate for that?
So according to the state regulations, California regulations, if they have a dementia diagnosis, we need to have them in our memory care community.
Thank you. That
Yes,
wouldn't be true. That would not be true if you had a couple in assisted living. If we came in as a couple, that would be all right. Is that right?
No, if they
No,
have a dementia,
okay.
yeah, if they have a dementia diagnosis, they would go into our memory care. Mhm. All for their safety.
Thank you.
Yes.
Any other questions?
Well, if I could jump in here, even though I'm not on the panel, I'd like to introduce Tom Weber, who's there somewhere with a palm tree behind him. He's the new Director of Community Relations at Vista Cove at Rancho Mirage. He's been with us now about a month. And so I just want to make sure you all knew who he was, because he's down there in the corner. The other thing, if I could follow up with some things Jack said, what I think makes Vista Cove Rancho Mirage is very unique is that we have neighborhoods. He talked about these two buildings. When you walk in the building, it's like a great room. That's where we can have all our major activities. And then there's 4 neighborhoods. Each neighborhood has 6 to 8 residents, and each neighborhood has its own kitchenette, dining room, bathrooms, laundry room, etc. So there really are like cobbled together, if you will, group homes, but they all are on the same campus. So that lends a lot of opportunity for us, especially during this pandemic time, to keep people without them being totally isolated. They can stay in their neighborhoods and be around other folks. But a lot of people like that configuration because you don't have long hallways. You just got small individual neighborhoods around.
Thank you, Floyd. I just want to, I'm really sorry that Matt was not able to join us. The reason we asked him to speak is that he owns small 6-bed homes. And that is another option for family members when they're looking at what their choices are. Even with memory care, there are single family residential homes that are licensed to care for a certain number of residents. And he has one in Desert Hot Springs and one in Cathedral City. So we just wanted you to know that that is, when you're looking at your options, that's another option for families to look into. Any other questions for any of the panel members? Okay, so I want to thank Jack and Jennifer and Heather. And if you have any questions for any of them, you can call Priscilla at our office. She has their contact information. Priscilla's number is 760-776-3100. And I want to thank you all for joining us today. Have a wonderful weekend, and know that we have a lot of exciting programs on Zoom every day of the week. So if you have any questions, I just gave you Priscilla's number. She's our program director for Alzheimer's Coachella Valley. And also our website is cvalzheimers.org. So have a nice weekend. Be safe, be well. See you soon.
Thanks, Pat.
Thank you, everybody.
Thank
you, everybody.
Thank you.